So at present, there are no therapies specifically targeting the brain in Wilson disease. It's a pity, we know that. But instead, all emerging approaches aim to prevent copper-mediated neurological injury by acting upstream, either by improving systemic copper control or by correcting the underlying metabolic defect. So Wilson disease is currently entering a very exciting period of therapeutic innovation, and we are very lucky in this rare disease. One promising area is the development of new next-generation copper-binding molecules. For example, we have the TDMQ20 that has shown encouraging results in preclinical models by selectively redistributing copper and restoring copper homeostasis rather than simply increasing copper excretion. Also, still in that early stage of development, it represents an innovative pharmacological strategy. Another exciting approach involves methanobactins, naturally occurring copper-binding peptides produced by bacteria. These molecules have an extraordinarily high affinity for copper and have demonstrated remarkable efficacy in animal models, rapidly removing excess hepatic copper, reversing liver injury, and improving survival. Whether they will also translate into neurological benefit in humans remains to be established, of course, but they represent one of the most promising new classes of copper-binding compounds. Beyond pharmacological therapies, gene therapy, of course, is now entering clinical development. By restoring ATP7B function in the liver, it aims to normalize copper metabolism and prevent further copper accumulation. Looking even further ahead, gene editing, particularly prime editing, offers the possibility of correcting disease-causing ATP7B mutation directly. Also, these approaches are still in the preclinical or early clinical stages. They have the potential to provide long-term correction of the underlying disease. So overall, I think we are entering a new area in Wilson disease. Rather than relying on a single treatment, future management will probably combine different therapeutic strategies with the common goal of preventing copper from reaching and damaging the brain before irreversible neurological injury occurs.